My name's Nick Ross. I'm a broadcaster, I'm a journalist, probably best known for crime rather than health, but actually most of my energies over the last 20, 30 years have been very, very closely involved with the health services one way or another. I'm involved with a lot of healthcare charities and was a long time ago concerned particularly with the evidence basis of breast cancer. I'm now concerned with the evidence basis of all medicine, really, clinical interventions. And one of the things that's clear to me is it's not just enough to have doctors, to have nurses, radiotherapists, physiotherapists, hospital porters, and all the rest of it. What is absolutely critical is how well all this works together. And that requires information and communication skills. That requires IT, and we ought to call it for what it is. A lot of this is just about information systems really work well for the people who are organising the system, for the patients. That's why this conference is really so important, because if you underestimate the potency, the importance of e-health, you underestimate the importance of health. I mean, you're never going to achieve what you're trying to achieve.
HC2013 it's coming up in April. What's so special about the event, and why should people attend?
As everyone knows, health is big news, and not just Britain, everywhere in the world, and everywhere in the world is struggling. And particularly, of course, the NHS. It's struggling financially, it's struggling organisationally. We've had scandals. The Stafford case, frankly, it's not just a local issue, if only it was. And there are all sorts of other issues as well. I mean, this is, from a day or two ago, this is the Secretary of State talking about failings which have cost 30,000 lives in the NHS. We have serious problems, so does every other country. And all of these things really come down to two key problems. They're information and communication. And at the heart of that is really what HC is all about. And that's why it's become so big. That's why it's become so crucial. That's why the Secretary of State for Health will be with us. That's why Archbishop Desmond Tutu will be with us. He's ambassador, as it were, for e-health for the developing world. That's why the speaker list for the conference, I mean, it reads like a who's who of all the VIPs in healthcare and in the NHS generally. And of course, you can look on the web to get details of the agenda. That's why we're involved with public health and patients as well. And it's really about benchmarking best practice. It's spreading the word about what are the best things to do. And I hope as many people as possible are going to be there. It's going to be big.